Hi everybody, welcome back to Laura A Vlogs. Um, I am back. Pretty much give you a little bit of an update. I had my my follow up with my primary care. When I recorded my last video, I wasn't doing too well, and that's been over 2 weeks. And I'm still not doing too well. I'm still struggling just to get over the last bit of the upper respiratory infection that I've been going through second time around. But I'm still feeling very fatigued. I'm still feeling like having a lot of muscle weakness. So it's been a struggle since I last filmed the video, and I wanted to give you guys a breakdown on how my appointment went. Yeah, I've been pretty much, like working, focused on working, but also on my days off, trying to rest as much as possible, because unfortunately, when you're dealing with chronic illness, sometimes it's telling me you have to listen to your body more. And that's where I'm at now, because now I have to pace myself a little differently again. It's almost like readapting to another change in myself. So, I'm trying to get acclimated again to go through this. So I had my appointment. I had to be at the hospital today, which I'm filming Monday, July 7th. My appointment was for 3:30, so I had to be at the hospital by 3:15. So sure enough, I got there on time. I did my initial check-in. I had to wait like at least like 15, 20 minutes to get called to get the vitals done. Unfortunately, my body decided, you know what, we're going to have some fun with you today. And since like I mentioned, I had that upper respiratory infection, so I'm still having a little bit of an issue when I get these coughing fits, because I have that phlegm that is dying to come out. And the phlegm is not even has any, like it doesn't look like it has anything. I'm trying to say is like, usually like when you have an upper respiratory infection, you see the different color changes on the phlegm. Mine kept coming up clear, but the problem is that it just, unfortunately, my body is trying to get it out, and so I start going through a coughing fit, because then I get this little tickle in my throat, and sure enough, I started coughing and coughing and coughing to the point that I felt like I was running out of breath. And so luckily I have to carry like a bottle of water and a bunch of Halls in my bag. So anytime this happens, I'd be able to like keep it under control somehow. So sure enough, I did that. I took out the water bottle, try to get hydrated, and then found a piece of Halls. And Halls, if you guys don't know, it's like it looks like candy, but it's not candy. It's more for like if you have like a cold and you having like congestion and like sometimes tickle and whatnot. It helps for the like there's a like a lit it has menthol. It has menthol in the ones I get, because it alleviates a lot what's going on in the chest area. So I suck on that until my body just feels the relief especially in the lung area. So that's why I keep, if you guys don't know from other countries, that's what it is. It's like a candy. It's like a Ricola or, some other one. But it's just a little more concentrated. So I always carry that in my bag. And so I was able to take that, and you know, and it started helping alleviate a lot of the tightness in the chest. And then it just helped me, like, it practically opened up, like my throat area, it just, everything opened up. And then when they called me in, the nurse asked me, how you feeling? I'm like, not so great right now. Not so great, because I wasn't feeling well. And so she was like, okay, we're going to take your vitals. So, of course, I had my weight done. Then after that, then I went and they took my blood pressure reading, because this morning, I think that this morning's reading was it was kind of high. I'm not going to lie. It was 1:30. No, this was last night. This morning was 142/97. So it was pretty high. And when they took my reading, I think it was like 189/137. And she was like, whoa, it's really, really high. Do you have any headaches? I'm like, I'm just feeling very lousy right now. Which is true. I was not feeling any specific headaches. But I just didn't feel well. And that, you know, that reading alone would have left me in the hospital with a heart attack. That's how sensitive my body has become. It's just like, now my body is just like, any moment it's gonna give out. And so she was like, did you take your medication today? I told her, yes, I did take my medication. So she was like, okay, well, I'm gonna let the doctor know, and then soon enough she's gonna call you. So she'll call you, as you know, I'm gonna have her, you know, call you as soon as she can. I'm like, okay. So I was in the waiting area maybe about like a good 20 minutes, because when I went to sit down, that's when they called somebody else, and she called somebody else in. So that was a while. It took like maybe 20-25 minutes on that visit. And then finally she was able to call me. And I go in, she's like, so I haven't seen you for a while. It's been a long time. How you feeling? And I was like, I'm not feeling great. I told her, I think it's time for me to have a conversation with the rheumatologist. I think it's time to do catch up, because the way that I'm being feeling as of lately, this is not good what I'm going through. I said, because everybody could have their wonderful best life, the best summer, hot girl, hot boy summer, but I'm practically dying in front of everyone. And what I'm going through is not fun. And I think it's time to get really check thoroughly what's going on physically. So I gave her a rundown of everything that I've been going through, regarding to the flare-ups that I've been through since April, and even up to last month. I told her the different things that I experienced, the symptoms. I even showed her pictures, so she knows that I wasn't bullshitting her. And then she was going through the old stuff, and she was like, yeah, because it shows here that you were diagnosed with fibromyalgia. And I did do one video about it. And but the thing is, when it comes to fibromyalgia, like I explained to her, because she, you know, examined me, she was asking me which points of my body feel pain. So she's touching me on certain points, and certain points I was feeling pain. But I told her, aside of the fibromyalgia, what is getting to me is the fact that when I'm having these fatigue moments, it's really hindering my quality of life, because now it's affecting me job wise. It's also affecting me quality time with my sons, because my family wants to do fun stuff, and I'm the type of person, I want to have fun too. I think I deserve to enjoy my life as I'm getting older, and I'm not going to live forever, but at least enjoy what little time I have on this earth and really appreciate spending quality time with my family. And so I said to her, those other aspects that I went through, and I had to explain to her about my trip in Canada, how it really affected me physically, especially when it comes to the warmer weather. Like, I can't walk more than 3 blocks before I start breaking down. I told her that is not normal. And that I don't see it as fibromyalgia. I just see there's something else going on in my body. I said, she goes to me, yeah, because the rheumatologist suggested that that you were supposed to, try some medication for the fibromyalgia. And I wasn't even told. I was definitely not told about that. And I was like, you know what? With all the years that I've been coming here, I wasn't even notified about that. I said, because it would have been nice if he would have told me that. So, sure enough, she gave me choices of which medication I'm gonna take. So she suggested gabapentin or Lyrica, because Lyrica has a lower dosage on for the pain, like it's like the sister. She called it the sister of gabapentin, that will help me with not only with the pain, but elevate the mood that I'm going through, or Cymbalta. And when she mentioned about Cymbalta, I was like, I don't think I'm ready for Cymbalta, because it sounds very strong. And especially with the way my body goes, I said, I'm willing to try the Lyrica and see how it goes. So she was like, okay. So I'm going to try that. She says, at least so we can show that we have made an attempt to, she wants to leave a notation for the rheumatologist, at least to show that we are making an attempt to resolve at least that part. Then she mentioned about me getting a whole bunch of blood tests, at least to see where my blood levels are regarding to my illness, at least to get that door started, and so she had me running like a whole bunch of tests. I took my blood. It's right there. Right there. So she said she's going to call me during the week to let me know what was the results of that test. And those tests, and that is. You see, I can barely talk because I'm shutting down. So she'll call me during the week to notify me what were the results of the test. She wants to check everything out just to make sure I'm okay. Then the problem, getting back to the Lyrica. So it looks like that my health insurance has denied me getting Lyrica or any other medication. So now she has to find a way to get medically approved for the insurance for me to receive that medication. So she says, I'm going to work on that to make sure that you get that medication. We're going to let you know through your insurance. Your insurance is going to notify you whether you got approved, and then the pharmacist is going to call you once they receive the medication, so they can let you know to pick it up. But she says we're going to work on the end of getting approval through your insurance regarding to getting the Lyrica approved. So I was like, okay, that's fine. So so she said that she was gonna put in the referral for the rheumatologist, which I know is gonna take months, because the last time she did that, I didn't get to see the rheumatologist until almost December, and most likely it's gonna head that way again. So in the meantime, she just wants me to focus on, getting myself, like more settled, try to get me to relax. She was happy to hear that I was going to therapy every week. Also, since my blood pressure was sky high, my medication will be changing. So there will be an increase on my blood pressure, because she is noticing that the elevations are getting higher and higher. So she wants me to get a higher dosage of the medication. So she says, in the meantime, until I get my next refill, I will do is just take 2 of the pills a day. So the current pills that I'm doing right now, that I could drink twice a day. And then after that, then just get the new updated, because I'm taking lisinopril combo, and so I'll be taking that. I'll give you an update on the next time on what is the amount on the blood pressure, because right now I can't even think if I wanted to. You see, this is what happens really when I go through a flare up and I'm not well, that I become really, really loopy. And this is not like I'm looking for like for people to feel sorry for me, because it's not that. It's just that to let you guys know, this is what I really, really go through in my personal time, is having a hard time staying focused, and just really giving you a detailed conversation about what I went through. It's a big problem right now, because as you can see, I'm stuttering right now. I'm stuttering and I'm having a hard time even bringing out the words, and it really fucking sucks. It sucks, but I'm trying to pace myself, because you know what? The devil's not gonna win this race. I am fighting for my life right now. And I refuse to die. Not on the devil's watch. So just letting you know, I'm fighting. So in the meantime, I will go, continue on with my life. I will see my doctor in 2 months. So I already have the appointment set up. I'll be seeing her in September. So basically a week after my treatment that I'll be receiving for the Zometa. So I'll have an appointment with my primary care. So I guess she wants to play catch up to see how I've been doing with the Lyrica. Hopefully that everything works out with that, and then take it from there. But I will definitely give you guys a breakdown on how my blood levels are as of today's test. I will do an updated video for that, and I'll give you an update on if I was able to get an appointment with the rheumatologist. And so pretty much everything's up in the air for now, and hopefully hope for the best, because the one thing I wanted to point out, she wanted to know whether I was if I'm considering doing like going for disability. And I personally am not. Right now, I feel that there's still life in me to do what I need to do. And I've always been a worker all my life. And so to resort on the disability right now I don't see that right now. Unless it gets to the point that I just can't do it, then I will just cave in. And I'm being emotional because I don't want to. I've been so independent in my life. And I can't. Because it's almost like if I'm giving up on myself, if I go on that route. And I refuse to give up of who I am as a person. And it's nothing about being ashamed. So don't get that wrong. Because I don't look down on people who are on disability because their ailments are getting worse and worse for them. And it has nothing to do with that. But it's me as a person who is used to living my life and being productive, because that's what gets me going. It's just staying productive. And so I refuse to stop and cave in to my illness, because then it means I'm giving up on myself. So this is my motivation, is just staying focused on what I need to do. That's all. And please, anybody who is going through this illness, don't think that I'm looking down on you because you have to make choices because of the things you're going through physically, because it has nothing to do with that. You know, I'm just talking about me as a person who is going through it too. But in my situation, I need, for my own mental sanity, to keep going. Anyway, so that is pretty much it. And I'm going to calm down. I'm going to take a shower. And I'm going to relax. Because I deserve it. Besides, I got a busy day tomorrow. So anyway, and that is pretty much it. If you are new to the channel, and as you can see, I don't have tissues with me. Darn it. I hate doing that. If you are new to the channel, you are very much welcome to subscribe. You guys, if you guys are going through what I'm going through regarding to these flare-ups, even having fibromyalgia, just drop a comment on the comment section on this video. I want to hear your story. So I will give you an update at the end of the week and let you guys know what happened and what's going to happen next. And yeah, stay tuned. I hope you have a wonderful day or an evening, and I'll catch you guys soon on the next vlog. Bye.